With us now to talk about regional efforts to improve the lives of aging folks in rural areas. We have two folks with us today for that conversation. We have from the Minnesota River Area Agency on Aging, and she's from Mankato. We have Kim Madsen. Thanks, Kim.
Thank you.
And we also have Lori Peterson, who's with the Chippewa County Montevideo Hospital. Thanks both for coming in.
Thank you.
So we want to talk today about some challenges or some problems and also some solutions, but let's start with some of the challenges first. So what are some of the biggest challenges right now that either one of you is seeing with aging populations in Minnesota? And Kim, I'd like to start with you if we could. What are some of the challenges?
Yeah, so at the Minnesota River Area Agency on Aging, we cover the southwest 27 counties of the state. There are other area agencies on aging across the rest of the state. But in rural, what we're seeing is housing, affordable housing, senior housing. So we're looking at having the correct width of doorways, no stairs, the one level living that really is more convenient, and not having the massive houses. And you'll see that many times over and over if you go and search out YouTube or other videos that are dealing with information on housing, is that we have built our communities really with 3-4 bedroom ramblers, and as we're having the aging population, no longer do we need a 3 or 4 bedroom rambler, but people wanting to maintain and stay in their homes. So really a housing, affordable health care, access to health care, limited services, and this falls in the transportation, is once I no longer decide or feel that I can drive any longer, and if I'm in a small community, and just for example of 400 people, is that there might not be a daily bus route. In Willmar, we have that daily community transit that goes, but if you're in Morton, Minnesota, you don't have that.
Lori, in your work in Montevideo, there's the same kind of challenges that you've seen with it?
In my work, I work as a memory care coordinator. And so we know that there are people living at home with dementia or memory loss, and even trying to get them connected to resources so that they can stay in their homes and make things work for a longer period of time is so very important. And so, there's a lot of challenges, but we just need to help reach out and help connect people to those resources.
When you talk about resources and services, that leads to the question about, services that people may need to have access to, but they don't necessarily even know the services are available. Are there some examples of things that can really help folks as they go through those issues?
We have a memory care clinic in Montevideo, and so people can come and have their cognitive or their memories or their thinking skills evaluated. And then once that process is over, my position is to help people with memory loss make those connections. There are a lot of resources available, and when a person receives a diagnosis and if they're just sent out the door, oftentimes they have no idea where to start. And so I can help put those pieces of the puzzle together for them. We have things like in-home respite, where a person can come in and provide some respite for the caregiver. We have a respite program in Montevideo that a lot of people are not taking advantage of, where a person with dementia can come for 4 hours and the caregiver gets some relief. But there are a lot of programs through the Alzheimer's Association, and we just need to connect and educate people.
And I'm sure, Kim, that over the entire region you deal with, you probably see this sort of story repeated over and over again, right?
It is, and it's on multifaceted levels. So here we're talking about dementia, but you can really talk about, as we age, we really become a society becoming fearful of aging. And that shouldn't be. And as we look, I work in Graceville, Ortonville, across these existing counties right here, and my staff work the other areas. But we're, as program developers, really out trying to work with hospitals, clinics, agencies to institute and implement programs such as Matter of Balance, powerful tools for caregivers. Caregivers are an utmost importance when we're talking about rural Minnesota, and really helping any community figure out, do a community assessment, figure out what programs could be most helpful for the aging population within your community. Because if there aren't those programs, people are going to move. And if this has been my home and I raised my family here, I would love to stay in my home. But if I can't, then what are my other options for housing? What are the programs that will help me stay here in this community and with the people who are my friends?
We don't want to lose people.
Right.
You know, oftentimes if, like, we grew up in a very small community, and so there aren't all the housing options. So if a person cannot live in their home anymore, or maybe we should even back that up, maybe they just need some services to come into the home to assist them to stay in their homes longer. And there are those resources available. But if it gets past that level and people need an assisted living or need that little next step, oftentimes some of our rural communities don't have that to offer. And if that's the case and then they have to move to a larger community, we lose them. Because once they leave our small community, they're no longer a part of that community.
And some of those challenges, I suppose, Lori, are as simple as a grocery store,
Right.
being able to walk to a grocery store if it's there, inability perhaps to drive anymore a few blocks if they're unable. So, I mean, some of these things, if you look at them, may be relatively simple for other people to help solve.
Exactly, and this is one of the things Lori and I were discussing just earlier, is how we really need communities to start to rally and support their neighbor. And so, because if I no longer can go to the community center for my meal because I don't drive, or if I need to stay in my home for safety reasons, how can we get organizations and individuals to start volunteering? Say, my company is going to take January and we're going to deliver those 5 meals every day. We really need to figure out how as a society we can rally to support our growing population of elders, because if we don't, it's hard to sustain those programs. Sure. And that's when it comes down to, is we can create any program, but if there isn't a sustainability factor to it, they go away and we're right back to square one. So we're always looking for, how do we sustain a program if we're going to build it?
You said that at the hospital, for example, you have people who specialize in this, so they will help people to take the first steps and understand what the challenges are, what the cognitive impairments are, or in their own home, for example, what little things they may need to help them stay there. Are those all part of the first steps typically?
Yes, well, actually, the first step would be just getting that memory screen, you know, if we're talking dementia.
Sure.
And that can come at every year at their Medicare physical, if you will. That's part of that. And if people aren't offered that, they should really ask for it. Because it is important to know how your memory is doing.
Right, it's to get the baseline. And even so, I'm in my 40s and I know where my cognitive baseline is. Because it doesn't, if your cognitive ability changes, it doesn't necessarily mean you're going towards dementia or Alzheimer's, but there are things that you can change in your life to create a better quality of life. So for everyone to understand where their baseline is cognitively is just like knowing your baseline for your blood pressure or your sugar. I mean, it's just any of those. It really should fall right in line. And we shouldn't be afraid, because sometimes if our cognitive changes, it might be due to a medication interaction. It doesn't always mean, but we're so fearful as a society, and of the kind of the taboo around cognitive change is Alzheimer's or dementia. And Lori can speak more to it because she's the one who sees that every day. But I think it's empowering, and the more that we know and the more that we learn and empower ourselves, it just creates a better life.
I know we've got about a minute and a half left here, so I just want to touch on some of the solutions, places to go, because there's things like the senior linkage line, which we'll mention in a moment, so folks can get ready with a pencil for that one. But what are some of the other things that, as people start to deal with these aging issues, what are some of the resources or places they can go after this program is over to look up more things? So, Kim? So
the senior linkage line is the Minnesota Board of Aging Senior Linkage Line. It's an 800 number. It's 800-333-2433. And that is from 8 to 4:30. There's someone who can answer any question. I look at them as the navigator on any senior-related issue. If you have a Medicare question, we do have senior outreach specialists who do one-to-one consulting for that. Medicare, any question you might have on finding a resource.
Okay.
Also, minnesotahelp.info is also another great website, or the Minnesota River Area Agency on Aging website also.
Okay. Lori, tips that you would have for folks on where to go?
Well, if they're concerned, the Alzheimer's Association has a wonderful website, and that's actonalz.com, I believe. And so they could go there. And of course, if it's more right in this area and they want to give a call to the Chippewa County Montevideo Hospital, we could learn more about our memory care clinic, and we could certainly share that information with them.
Okay, great. Kim Madsen, Lori Peterson, thank you for joining us in Compass for a discussion about aging. Thanks very much. And that's it for this week on the topic of aging in rural areas. Our Compass producer, Laura K. Prosser, will take it from here and end this week's episode with the next installment of the Compass Literature Corner. Thanks for watching.